Hello, everybody. Today, I welcome Pamela Cipriano onto the podcast, and we are going to have what I think is going to be a very interesting conversation for many of you. We're going to focus on Lyme disease today and Epstein-Barr virus, something that I know hits home with a lot of you. Um, dare I say, very prevalent up here in Canada, Dr. Cipriano. So I'm delighted that you could make time to come on to this call and just discuss it with me, and hopefully we'll leave everyone with some nuggets of gold and pieces of action they can start to implement immediately. So, how
Thank
are
you so
you?
much. Okay. Good, thank you. Thank you so much for having me. I'm very excited about this podcast.
It's my pleasure. I am too, because it's rare that you come across someone that is as specialized in these diseases as you are. And they seem to be more and more prevalent as time goes on, especially in the likes of Canada or North America, where we're spending a lot of time, like with regards to Lyme, we're spending a lot of time outdoors. There's a lot of tick bites happening here every spring and summer. I had a client message me a few weeks ago, and she sent me a picture of a head with a tick attached to it. And I was like, who is that? And it was her daughter. Her 6-year-old daughter had the tick embedded into her head, and she had to, of course, scoop it out. But this is a whole other conversation that we're going to get into now, because the daughter has no symptoms, very much like your son didn't. So, if you wouldn't mind, let's hear a little bit about your background first, and then what happened with your son and his adventures with Lyme disease.
So, at the time, I knew as much about Lyme disease as every other mainstream doctor out there, which was absolutely nothing. He was 6 years old. I was working as a registered nurse. He had gotten bitten by a tick, had the bullseye rash. If he didn't have the bullseye rash, I would have never known he got bit by a tick because he had absolutely no symptoms. His pediatrician put him on, if I have to guess, 10 to 14 days worth of antibiotics, and we completely forgot about it. And then 13 years later, we were scuba diving, and he had a lot of pain and pressure in his lower abdomen. I brought him back to the hotel room, and I could find the tiniest hernia possible. Brought him to his pediatrician, who said the same thing. It was just a small hernia, but when the surgeon opened him up, he actually left him on the operating room table to come out and talk to me because he wanted to know if he had a connective tissue disorder. They found his abdominal wall to look like Swiss cheese.
Mhm.
So the bacteria that comes from tick, for him, it was Lyme disease, so it was Borrelia, actually uses your proteins as energy. So if that's what caused all of these hernias, that's a working hypothesis. We really don't know. But since being treated for Lyme disease, all his musculature has come back. He was always very thin for his age and his height. That was just part of his makeup. But after he got treated for Lyme disease, he's muscular. He put some weight on. He looks absolutely wonderful, much more healthy. But it was an absolute nightmare because it was after the surgery, there's always a trigger when it comes to a chronic form of Lyme disease, which a lot of times is misdiagnosed as fibromyalgia. Very similar symptoms, the same trigger where it's some kind of a trauma, whether it's emotional, physical, something like that. For him, it was the surgery that was his trigger. And it was right after the surgery that all his symptoms started, the brain fog, the joint pain, the difficulty urinating. He had urinary hesitancy, he felt inflamed throughout his entire body. And it took years, literally 10 years for me to figure out what was going on with my child. So in that 10-year period, he had seen a number of doctors. He saw gastroenterology, urology, he saw other surgeons, he saw neurology, and no one could figure out what it was. The only one that actually was thinking Lyme was the urologist. He was the only one that actually did some testing for Lyme disease. Unfortunately, it was local testing, which was never really meant to be used for diagnostic purposes. It's actually used for epidemiological purposes. Somehow, I believe it was infectious disease that started using the ELISA with the Western blot for diagnostic purposes, but it's a terrible test because the main bands that are necessary to identify Lyme disease are missing from the local test. So I had clearly his was always negative every time he got tested by urology.
Mhm.
Um, about 6 years into this, and now he's about 26 years old, so 7 years into it. He received the diagnosis of it's all in your head. There's nothing wrong with you.
Mhm.
It was an absolutely terrible time for him. By the time he was 29, and he was a month away from turning 30, I finally found one research article in the Journal of Urology, which was a case study, and it had his exact symptoms. And so I contacted the researcher who referred me to the International Lyme and Associated Disease Society. This was back in 2017, and I became a member in 2018, and I've been with them ever since. I did their training courses. I found Dr. Richard Horowitz, Lyme expert. I went away for training with him. I did preceptorships with him, and that's how I was able to heal my son. And since then, I've healed thousands of other people that are just turned away from the mainstream provider because there's no education on tick-borne diseases.
Mhm.
Until our government comes to terms with,
This
Lyme
is a
disease being
real
an
thing.
epidemic.
Yeah.
Yeah. Doctors don't have any reason to really learn about it unless it starts in their family. And my second ILADS conference, I just took a quick poll, like for the doctors next to me, like how did they get involved? And it was always a family member who was falling through the cracks. They had all of these symptoms and their doctors didn't know what it was. They were being referred to rheumatology, being put on biologics, which really suppresses your immune system. And if you do have a tick-borne disease or other type of an infective disease, it actually worsens your condition. So you feel better because we're suppressing your immune system's ability to recognize what's going on. So your symptoms are going away, but at the detriment of a significant infection that's going through your entire body. Um,
It's running rampant. You're just masking the symptoms.
that's all you're doing when you're going on these biologics. They don't do anything to cure the problem. What they really do is just suppress the symptoms. So it's terrible what goes on in medicine. It
So
really is.
even though biologics seem to improve quality of life for a lot of people, especially in the immediate, do you think in the long term, what we're not seeing, they're doing more damage than good?
In my personal opinion, I think that. I don't have any research to back that up. But when I have a patient I have a patient came to me last year, um, hot mess, tons of symptoms. I tested her for tick-borne diseases, and local testing came back before IGeneX testing did. And so I knew she had tick-borne diseases because her brucella came back positive. And when I called her to let her know this, I don't believe she actually got IGeneX testing done now that I think about it. Her brucella came back positive, so I wanted her to get the tick-borne disease testing done. But at the same time, she was seeing me. She had an appointment with rheumatology from her primary care doctor. So she wanted to see what rheumatology was going to say first. And so I had warned her that if they put her on biologics for her symptoms, it's going to cause more issues in her body. And a year later, she comes to me. Now she's already on Humira and other biologics, and IGeneX testing was done. And her immune system actually suppressed her immune system, or I'm sorry, the medication suppressed her immune system enough that we weren't getting a positive result from IGeneX. We were getting an indeterminate.
Mm.
So I said that to her, like the testing is based on your immune system. And because now she's on this medication that suppresses her immune system, I can't get a positive result from IGeneX. So she ended up going on medication for the tick-borne diseases that were coming back indeterminate, coming off of the biologics. And then all of her symptoms were improving on the treatment for tick-borne diseases. When we repeated the IGeneX testing after she was off the biologics, they all came back positive. So there's a problem with that because the testing itself, no matter what lab you use, requires a working immune system. So backing up to my son, when I first tested him, it was through Armin Labs in Germany, and he came back negative. Then I tested him through IGeneX Labs, and it was negative. Then local labs, and it was negative. And it's like I read this research article, this case report. Like I knew this had to be what was going on with my son, and so I started him on antibiotics, even with a negative Lyme test. In the meantime, I was able to go through past meetings or conferences through ILADS, and I found one conference where Dr. Burrascano was talking about the HNK1 test, which tests how many natural killer cells you have in your body. If that number is below 60, you can end up with a false negative Lyme test. And my son's was 10. And to this day, I have never had anyone with such a low level of natural killer cells at the level of 10. So he had had this since he was 6 years old. So
Mm.
now he's 29 when I'm doing all of this testing, and started off at, yeah, 29 when I was finally figured out what was going on, and everything was negative. And that's when I realized I had to just treat him for the Lyme disease, even though tests were coming back negative, because his killer cells were so low in count, we couldn't get a positive result.
So is the Brucella the main pathogen you're looking for, or do you also look for Bartonella as well? What should people be looking for?
So IGeneX has a panel right now, which costs just shy of $1,300, and it checks for Lyme disease, babesiosis, tick-borne relapsing fever, and Bartonella. Those are the tick-borne diseases that are going to change your life. Those are the ones that really cause a lot of issues when it comes to your overall health. So Lyme disease can be neuroborreliosis. It can inflame the brain. Babesiosis is a parasite that lives in the red blood cells. It can cause hemolytic anemia. It can cause ITP, idiopathic thrombocytopenia. It can cause DIC, which is a blood clotting disorder where all of your blood clots. It's a cousin to malaria, so much more difficult to get rid of than malaria is. Bartonella, my least favorite of all the tick-borne diseases, can be you can contract it from ticks or almost every biting insect at this point. They're also finding it in mosquitoes now, and that's the one that is going to cause a lot of neurological issues. Headaches in the top of the head, the occipital area, neck pain, spine pain, burning sensation down the legs, under the feet, numbness and tingling. Um, this is the one that will eventually result in a misdiagnosis of ALS. So ALS is a diagnosis of exclusion.
Mm.
If they cannot find any reason for your symptoms, then they diagnose you with ALS. But they're also using local testing for tick-borne diseases. I have never had a positive Bartonella in the 10 years I've been treating people with Lyme disease. And a colleague of mine who's been doing this for over 30 years has never gotten a positive Bartonella from local testing. So there's a real issue when you're a mainstream provider and you're treating people or, working them up for a diagnosis of ALS, and you're using labs that are subpar.
Mm.
According to the American Pathology Association, the testing should be at least 90% accurate for it to be approved. That is not the case for tick-borne diseases. Some of them are only 30% accurate, some of them are 50% accurate, some of them are 70% accurate. So to get diagnosed with ALS, literally a death sentence, it would be nice to have a lab that you can use to get accurate testing done, especially when somebody is in the beginning stages of getting worked up, because by the time they see me, they're almost in a wheelchair or already in a wheelchair, which
Mm.
is a real issue because for me to get them out of that wheelchair now is going to take partly a miracle.
Mm. So
Because at
you
that point,
think
no matter
some
what I
of
do, I
these,
really can't get them better.
do you think some of these ALS diagnoses are misdiagnoses, that they
I
are,
think the vast majority are.
and that mosquitoes are going to be the cause of mass human elimination at this stage?
Could be. We've known about Lyme disease since the 1970s, and literally nothing's been done about it. So
Mhm.
now we have global warming, we have a whole bunch of other reasons, and we have, especially in the northeast corner of the United States and up through Canada, so many ticks. I mean, we are infested with ticks here in Connecticut. This is where it all started in Lyme, Connecticut. So, I don't know. I always say the right person has to get this disease for something to really change. And I
Mm.
don't wish it on anyone, but somebody needs to open their eyes who is in a position of power to be able to save the rest of the population from one more tick-borne disease.
But it starts with adequate testing first.
It has to start with adequate testing because if you don't know you have it and you don't have an identification, so IGeneX is great, but Medicare in the United States is the only insurance that pays for IGeneX testing, and they're literally the gold standard.
Mm.
Generally, in the United States, Medicare will start the ball. So if they start something, all the other insurance companies will follow. No one else will follow. Nobody else pays for IGeneX. In fact, unless you have straight Medicare with like AARP or a supplemental plan, and you're with an Advantage plan, that Advantage plan is just another insurance company. They will not pay for IGeneX testing. So if you're at Medicare age, really do your due diligence to make sure if you do get an Advantage plan and they promise you all the bells and whistles plus everything Medicare covered, make sure it includes IGeneX testing because that's where people get really um, sidelined, to be honest with you.
Why
You
do you
know,
think it would seem to me that there's a fear there of including IGeneX? Why do you think they won't cover IGeneX so broadly?
they don't want to pay for it. They don't want to pay for the testing. They don't want to pay for the treatment. And as long as the government, the American Medical Association says it doesn't exist, there's no need to worry, there's no reason for them
Oh,
to pay
okay.
for it. So back in the 90s, there was a Lyme vaccine called Lymerix. It was infectious disease through Yale and some other areas that put their own personal funds into this vaccination, which if you had a specific gene, it could give you a chronic form of arthritis that felt like Lyme arthritis.
Mhm.
The insurance companies wouldn't pay for this genetic testing, and rather than have, offer it to the patient to pay for it out of pocket, they just gave it to anybody who wanted this vaccine. Well, more people than not ended up with this chronic form of arthritis
Mhm.
and ended up getting pulled from the market. And when it got pulled from the market, I actually have the original advertisement for this vaccination, and it was all about the chronic symptoms you'll have if you end up with Lyme disease and are misdiagnosed and not treated promptly. So clearly they knew it was an issue. Clearly there was a vaccine that was on the market for this issue. But when they lost all their money on it and it got pulled from the market, Infectious Disease Society came out with a broad statement saying there is no such thing as chronic Lyme disease. Once you get treated with 2 weeks of antibiotics, any symptom after that is post-treatment something or other, post-treatment Lyme syndrome or something like that. In other words, you still have all the symptoms, but you don't actually have the disease anymore. Well, if
And
that's the
like
case,
long COVID.
yeah, if that's the case, why did you come up with the vaccine to begin with?
Hmm. So
What's the
that's,
sense in having a vaccination if it's not gonna? Do you see where I'm coming from?
yeah.
So
And they
those are the
still
things that really
stand
upset
by
me.
that now, do they? Like that there's
They,
no such thing as Lyme?
they still stand by that right now. So right now, Pfizer has another Lyme vaccine on the market. It's supposed to be coming to fruition. According to the animal studies, it's not as accurate, we'll say, as it should be. So I'm not sure if it's actually going to come to market or not. But I'm in the United States. I don't know about Canada, but in the United States, when there's a new vaccine on the market, it gets thrown down your throat by every single doctor that you see. I can't wait for all of these people who are denying Lyme disease. Now they're going to be forced to talk about this vaccination, because that's where they make their money. The more vaccines they administer, the more money that they make. So I just can't wait to hear what this dialogue is going to be like.
Mm. So there's definitely a money involvement as usual.
Yeah, we don't follow science in this country. We follow money, honestly. It's disgusting.
So IGeneX, are they doing serum testing or is it urine testing?
It's serum. So it's
Okay.
blood work.
And that's the most accurate way to test.
It is for tick-borne diseases.
Are you aware of any labs in Canada or just over the border from you that are doing this?
I don't. I have patients in other countries. We usually will use I think it's real-time labs that has I think it's real-time labs. I'm not positive about that. That is able to order IGeneX. So if you order it through real-time labs, you're able to get it to you. I have to just look up that information to be absolutely certain. But the patients I've had in Australia, I generally will just order the IGeneX for them, and then it comes to us and we send it out to them and then they mail it back to
Oh,
IGeneX.
okay. Okay. So where there's a will, there's a way, as they say.
Yeah,
I'm
I always seem to find the way to help my patients. I really do, no matter what it is.
good. So I'm just curious back to what you were saying about your son. Where was the bullseye that you found on him? And then was the hernia directly under that or somewhere else?
No, the bullseye was on his calf. The hernia was in his lower abdomen. In fact, the hernia was his entire abdominal wall. They described it as Swiss cheese. So where the pain was where I felt the hernia, but he
Mm.
had hernias everywhere. He just wasn't having pain anywhere but in his left lower quadrant.
Jeez. So just to kind of summarize this, before we look at treatments, a lot of these symptoms that you're mentioning seem to be a lot that at least I hear in my groups all the time. A lot of these chronic inflammatory issues, fatigue issues, malaise, because there is a mental health component to this, isn't there?
There definitely is. So if it's just Lyme disease, Lyme is the most well-known of all of the diseases. It is not the most dangerous of all of them. It happens to be the most well-known though. So people don't generally die of Lyme disease. They die of suicide because they're told consistently that there's nothing wrong with them. All of their symptoms are in their head. And you can only say that to somebody so many times before there's why bother living? You know what I'm saying? Um, Bartonella, much more serious. Babesiosis, another one that can definitely take your life. Tick-borne relapsing fever, more like Lyme disease. Although I've been seeing a lot more Borrelia miyamotoi, which is one of the tick-borne relapsing fever infections. That gets people exceptionally sick. That I've been seeing more and more over the past several weeks.
But what are the first lines of treatment if you do get it? I don't want to say if you do get a definite diagnosis, because I would assume that even if you had a lot of these symptoms and you did the treatments we're about to speak about, that you would see some sort of improvement regardless of a definite diagnosis or not.
Right. So in my practice, if somebody calls and says that they got bit by a tick, they automatically go on a month's worth of antibiotics because doxycycline or minocycline is going to cover the vast majority of tick-borne diseases. It's going to cover most of Lyme as long as it's an acute form of Lyme disease and haven't had Lyme before, it'll cover Lyme disease. It'll cover ehrlichiosis, anaplasmosis, brucella, tularemia, Q fever, Rocky Mountain spotted fever, stari, um, pretty much every other tick-borne disease except Bartonella and babesiosis. It's not going to cover those at all. Bartonella requires 3 antibiotics. One should be a macrolide, one should be a rifamycin, and then a tetracycline. And then babesiosis is a parasite, so it would be the same treatment as malaria with atovaquone, but we're taught to add on azithromycin because babesiosis can become an intracellular form of a parasite, and the azithromycin will has some antiparasitic properties, will help to kill it off.
You mentioned malaria, and I know
Hmm.
during COVID, there were people trying to connect malaria to the COVID virus, and then there was talk around ivermectin and hydroxychlorophyll. Do you think they are going to be efficacious treatments for Lyme or some of these disease-borne viruses?
So when you get bitten by a tick, that tick also bit wildlife, livestock, you know, all different types of people from all different socioeconomic groups. When a tick bites, they don't die like other insects do.
Mm.
They just go on to the next person and feed again, and the next person or animal and feed again. So if the animal has parasites, that person is going to end up with parasites. And I've had so many people, especially with roundworms, so many patients with Lyme disease also have roundworms. So when I treat, the labs here don't always have parasitologists. So trying to get a positive parasite diagnosis is very difficult unless you use a specialty lab. So there's times when I'll treat anecdotally with ivermectin or albendazole I'll use, and people will start passing the parasites. Once they pass the parasite themselves, the bacteria will hide in the parasites to hide themselves from the antibiotics. You get rid of the parasites, you get rid of a lot of bacteria at the same time. So when I have patients with, especially babesiosis, which is a parasite, I will add on ivermectin unless a person is having symptoms of parasites, and I add it on sooner than that. Um, Recently, I started doing some research on Bartonella. I'm actually in the process of doing a research report because my patients with Bartonella, when I add on ivermectin, they turn the corner so much easier than they do if I don't add on the ivermectin. Because when I'm killing off Bartonella, the Herxheimer reaction can be really severe,
Hmm.
especially the first 3 months. Patients have a really difficult time transitioning. So if I add on the ivermectin around that time, you could just watch how they just turn that corner. So I'm actually trying to see, especially the patients with Bartonella, if ivermectin is going to should be included in the treatment protocol.
So ivermectin is helping with some of that die-off and the symptoms that come with that. That's interesting.
Yeah, I think so. Bartonella is actually a bacteria, but it acts like a parasite. Whether ivermectin, helps with those patients or not, I really can't say right now. But it does decrease inflammation. It is an immune modulator. There's a lot of benefits to ivermectin besides antiparasitic. It's been repurposed in so many other ways. Um, and we do know that in COVID, it did work with COVID patients.
How prevalent do you think parasites are in people who have Lyme disease? Would you say everyone who has Lyme?
I wouldn't say everyone, but I feel like in the United States, for some strange reason, we're taught that unless you leave the country, you can't get parasites here.
Hmm.
I've never been one to drink the Kool-Aid, even when I was a student. If it didn't make sense to me, I kind of just put it on the back burner. I mean, fruits and vegetables are going to have parasites if you're not going to wash them really well. Some foods should be parboiled before you eat them because of the parasites. I mean, clearly we have parasites in the United States. There's no border control preventing parasites from entering
Well, if
here.
you've pets as well, pets carry
We
everything.
have, yeah, exactly. But I mean, I have had arguments with parasitologists that if the patient didn't leave the country, then they can't have parasites. That is the most ridiculous thing I've ever heard in my entire life. And if you're gonna actually buy into something like that, I think you need to find a different profession. I
Yeah.
mean, I'm not trying to be mean, but I
It's
mean,
kind of
let's use a little
common
bit of common
sense.
sense here, you
Yeah.
know? We have my husband and I rescue animals, but usually dogs and cats. I mean, at one time we had 7 dogs and 4 cats, and of course they're all sleeping on bed with us. So he and I do a parasite cleanse twice a year just to make sure that we're keeping ourselves as healthy as possible. Because now there's also a possible link between parasites and cancer.
Hmm.
Now, that's an entirely different subject, but when my mom was younger, she had said that, in her school age years, everybody got treated for parasites, whether they had them or not, before every year before school started. I think when the government was trying to make food safer, they did away with that, which I think was a big mistake. Because when they did away with that annual antiparasitic for school-age children, the amount of cancer increased exponentially. So I'm thinking that link might, there might be something to that link.
What was the
Um,
antiparasitic they were using? Do you know?
I honestly don't know. My mom's been gone so long, I wouldn't be able to ask her. So I don't even know what they were using, but she just said they used to every year, everybody got treated for parasites.
Oh, it'll be so interesting to find out what that was. What, if you don't mind me asking, what is the parasite cleanse that yourself and your husband do each year?
We do it twice a year. We do albendazole and we do it twice a day for 3 days, right around the full moon. So it's the day before, the day of the full moon, and the day after. We usually do it like January and July.
Have you seen the parasites come out yourself?
I haven't seen any parasites. I don't get the diarrhea that I would expect if I had parasites, and neither has my husband. But I've had patients that have had the parasites, send me pictures, bring them in, things like that.
One of the perks of the job, the
Yeah.
pictures. I'm like, no, I don't need pictures. So, well, this has me thinking, do you think then there is a parasite connection to ALS then?
I don't know. Um, for it to be a parasite related to ALS, it would have to get into the nervous system,
Mhm.
specifically the brain. And I don't have any information on that at all.
Mm. Something interesting to think about, though.
But what I do see is Bartonella is going to be the most likely um, the tick-borne or vector-borne disease associated with ALS.
Mm,
Every patient I've
interesting.
had with ALS was always positive for Bartonella.
It's interesting. I have a new client that has ALS, and we've done a lot of work and seen a lot of progress, but there's always different avenues when you're working with someone and you're like, maybe I haven't looked at this or maybe I haven't looked at that. So before we move on to our next topic, because you know what people are like, if people don't want to try the pharmaceuticals, they want to know, are there any natural things that can help? And I always say to people, sometimes we just do need the pharmaceuticals. We need something hard and heavy to hit whatever the infection or the issue is. But there's a lot of people that are still hesitant and they want to know, well, is there something natural I can do at home? Could I use wormwood or something like that?
For tick-borne diseases or for
Yeah,
parasites?
for a tick. Or I'm sure someone's going to say, yeah, parasites for both.
So Dr. Bruner, I have all his books. He did not like antibiotics at all. But because these tick-borne diseases can really be game changers in your life, he recommended at least 1 month's worth of antibiotics, specifically doxycycline. And then
Mhm.
if you wanted to switch it over to all natural antimicrobials, I don't know of any antimicrobials specifically that would really fight Bartonella. But I have seen some success with, I've had patients who don't want to go on antibiotics. And if they have a newer case of Lyme disease, it's not going to be as detrimental to start them on supplements rather than antibiotics. But I use resveratrol, I use cat's claw, let me see, Cemento, I use Hootenea. Research Nutritionals has BLT. They also have I think it's called MLP, if I'm not mistaken. I might be wrong on that name. But there's a combination of tinctures that will help to fight off a number of tick-borne diseases. I wouldn't just focus on only Lyme disease. I would definitely try and cover all of them.
What
And then there,
about, I was
I'm
going to say,
sorry.
what about berberine or something like serapeptase, which can eat up inflammatory molecules? And
So serapeptase, I always add on. There's certain supplements I always add on when I start treatment for tick-borne diseases. Serapeptase and nattokinase are the two that I usually add on, sometimes lumbrokinase. But they're fibrinolytic, so what they do is they eat away anything in the body that is a non-living structure. So it could be biofilm, that's where we use it for Lyme disease. It could be cysts, lipomas, scar tissue, anything like that. There's even some research being done now on coronary artery disease to see if it'll help to eat away at the plaque. But when I start a person on treatment for tick-borne diseases, they also get serapeptase and nattokinase or lumbrokinase, liquid stevia. This research was done by Dr. Eva Sappi out of the University of New Haven. She found that stevia was the plant extract that helped to kill off biofilm. So biofilm is a housing structure inside the body that is impenetrable from with anything. Antibiotics can't get in there, the immune system can't get in there. Um, Serapeptase, when taken at the same time as liquid stevia, helps to break open the biofilm and then kill off the persister cells. Those persister cells will turn into mature bacteria and will start attacking the body. So when my son was first getting treated with antibiotics, every 3 weeks he got so sick
Mm,
that he would have to take a break from the antibiotics. And there's a reason you should not be treating your family member when it comes to medicine because you can't think logically. If I had a patient who every 3 weeks was getting sick and wasn't able to take their antibiotics, I would really try and encourage them to continue taking it. When it's your child and you saw how sick they were, your anxiety goes off the charts. You're like, oh my God, if he doesn't take this antibiotic, what's going to happen next?
mhm.
So, and I didn't have anybody to refer him to because I didn't know.
Nobody, yeah.
Yeah, I just had Dr. Horowitz who had actually trained me. I didn't really know anybody else at the time. Now I could send you to anybody you want. Um, so and again, it was Dr. Burrascano who was talking about every 3 weeks, the mature bacteria will come out of the biofilm, and this is what causes your natural killer cells to drop. So if this started at 6 years old, every 3 weeks, the mature bacteria comes out and his immune system kills it off. 3 weeks later, the mature bacteria comes out and the immune system kill it off. Eventually, your immune system is going to get tuckered out and it just can't kill off any more of this bacteria. And that's where your natural killer cells just start to drop. So, like I said, 60 to 360 is normal. The recommendation is anything under 100 could be a chronic form of Lyme disease. And again, his was only 10.
Mhm.
Like he almost had no natural killer cells in his body because of the amount of time he had Lyme disease.
That must have taken an awful toll on his adrenal glands because this is a chronic stress for over 20 years.
It was that. It was being in his 20s and losing out on all of his 20s because he was, he started off with the bladder issues. By his mid 20s, he had to learn how to self-catheterize himself because he could no longer urinate. It was a lot what this poor kid had to go through. I mean, it was it was an absolute nightmare. It really was.
Generally, with practitioners, kind of the same as what you were alluding to, that most doctors that do this, they had a family member and that was their kind of fuel on the fire to make them research. And a lot of practitioners, we say our mess becomes our message. We've um, experienced something and we then become a specialist in it. I'm curious with your son because of what he's been through. Is he going down some sort of pathway now that's going to lead him to help others in this area? Or he's just like, no, I'm over it.
Pretty much the second one. He is so over this.
He's just
He
going to be a
still has,
Formula One driver or something totally
yes,
different.
exactly. His bladder is still his issue. Um, I put him on a couple of antiparasitics. I tried him on albendazole, and all the inflammation went away. Like he felt absolutely amazing. We did that for the 3 days around the full moon. Then I just started him on ivermectin just to see how he was going to be able to tolerate that. And he had every symptom of a parasite infection. He had the diarrhea, he had the mood changes, he had the vomiting, he had the whole gamut.
Mhm.
So he's doing it right now twice a week. I think he's going to take a bit of a break from it and then maybe go back on it just to try and give his body a bit of a respite.
So he's still dealing with this all these years later.
Yeah, not like it was when he had active Lyme disease.
Mhm.
But this bacteria causes so much inflammation in the body. So when you're treating a patient, it's not just the antibiotics. It's all the supplements, it's all the detoxing. We do IV vitamin C here, which that actually made him feel the best. 60 grams in a liter bag. That made him feel absolutely the best because it gets rid of so much inflammation. It boosts the immune system.
And the
Those were
adrenals. Yeah.
yeah, those are the days he felt the best. But we have an infrared sauna here to help to, penetrate down the cellular level. We have halotherapy here for salt we have a salt generator for halotherapy. So it's the same as being in like a salt cave, but it's a much more concentrated amount. So you only need to be in there for 10 to 15 minutes and you really get a hefty dose of this. It helps to ionize the negative or defaults to the negative
Neutralize.
ion.
Yeah.
Yes, thank you. The positive ion so that they're more neutralized, which can happen, which leads to cancers and it leads to a host of other health problems. So, everything we do here is because of what I went through with my son with all the researching I did. He has a key to the office. He can come in here anytime to do the halotherapy, the infrared sauna. There's times when he was really under the weather and I would just go to his house and give him the IV vitamin C.
That is like 60 grams is a lot of vitamin C. Did that affect his bowel tolerance at all?
No, not at all. So there's a lot of research on vitamin C and cancer therapy.
Uh-huh.
And there's a naturopathic office in the Midwest who did research on the 60 grams of vitamin C in normal saline and showed that patients tolerated it exceptionally well. You have to
Probably,
make
yeah.
sure, yeah, you have to check their GP. Check what is the name of that test? Let me just look it up really quickly, just so if there's any practitioners listening. Uh,
And it's probably because it's not going through the bowels, it's going straight into the bloodstream.
it's correct. You're bypassing the gut completely in the liver.
I feel
It
like
is G6PD. So if you have a gene where you're G6PD deficient, it can cause hemolysis. It can cause you to bleed out. So you always have to get that level first before you start the high doses of IV vitamin C.
so you're not just jumping straight in and injecting yourself with a load of vitamin C.
Right. So I always start low. I always start with 4 grams and we go up to 8 grams and then 15 grams. So slowly, slowly. I never do anything at the full dose. Just to make sure the patient can tolerate it. But I have cancer patients that come to my office as well if they don't want to do chemotherapy. And I have one patient who transferred from a different medical spa to mine. And I had to get all the records from her doctor because she actually uses 70 grams, which I don't have any research on. So he had to send me all his research. And she went to see her oncologist recently. She has lymphoma, and her lymphoma is actually improving. So, there's a lot more out there for cancer treatment than we really know at this point. Everything we know about is chemotherapy, immunotherapy, but I think that there's other areas that are going to start opening up now that people are getting more and more inquisitive.
Plus, there's more and more voices that almost can't be stopped anymore. People are talking and people are listening.
I think you're right. And I think social media, the good and there's good and bad of it, but the good part is that people are able to spread the word where before, it was only coming from the medical professions.
Yeah. And with that said, after COVID, I feel like there's a lot more people now questioning the medical professionals and not taking everything they say as being 100% truth. So now people are looking down different avenues. And I must thank you because you would be in the category of these health professionals that were very much involved in COVID, but you were speaking out and saying, no, these are alternatives, these are other options we have when a lot of others were not.
COVID was a very strange time in this country. My younger son had traveled to Switzerland for the 2019-2020 New Year's. He was in college at the time. So he spent New Year's Eve in northern Italy. And COVID was in Italy at the time, but we didn't know about it yet. When he came back, he had all the symptoms of the flu. He called me up. He was in Rhode Island, which is the next state over, and literally every symptom of the flu. And so I called him in Tamiflu, which works. If you start Tamiflu within the first 24 to 48 hours, it stops the flu in its tracks and you get better much quicker. He did not, it didn't touch him. So I said to him, I don't know what this is. His big complaint was my lungs won't expand. My lungs feel like they're cement and they just won't expand. And I don't know if you had COVID, especially the first couple of strains that came around. But when I did get COVID, that's exactly what it felt like. Like you're trying to take in a breath and your lungs just don't feel like they're moving at all. So you're taking in very shallow breaths, just trying to get some air in, and that's what he was feeling. So I had him come to Connecticut, and he was getting me really nervous because I really didn't know what I was treating.
Mhm.
So, we got the chest x-ray, I got a CAT scan of his chest, I got an echocardiogram because his EKG was showing signs of like a cardiomyopathy. So I got an echocardiogram on him, which did show cardiomyopathy. I started him on azithromycin, prednisone, and nebulizer treatments. And within days, he felt improved. He was so much better. So now we find out about COVID, and we, as providers, we were told by the Department of Public Health not to treat them with anything because we didn't know what would work. Wait until the symptoms were severe enough to send them to the hospital, and then the hospital would take care of them. Again, this made absolutely no sense to me whatsoever. So I'm going to have my patients just suffer because you don't know how to treat it. Well, if you don't try and treat it, how are you supposed to learn how to treat it? So I was thinking about my son who had this episode. Now I'm learning about COVID symptoms. And so I had him get his blood tested, and sure enough, it was COVID. He has the markers for COVID. So any of my patients who call the office, because now all the offices were closed, we could only do telehealth visits. Um, if their breathing was okay, and they weren't really in any kind of distress, I kind of let it go because I wasn't really sure how to treat it. But if they were telling me the typical flu-like symptoms like my son had, and the difficulty breathing where their lungs just wouldn't expand, I put them on the same treatment that I put my son on. I had 3,000 patients in my practice at that time because I was still taking insurance. And not one of my patients ended up in the hospital, and not one of my patients died. And the patients that I did prescribe the azithromycin, the prednisone, and the nebulizer treatments to got letters from our government that I was practicing experimental medicine. And if they wanted to press charges, they would make sure I never did this to anybody else. You know what my patients did? They brought the letters into my office and gave them to me
Hmm.
and said, "You literally saved my life. The last thing I'm going to do is report you for doing what you're supposed to do."
Hmm.
Because if you ended up in the hospital, honestly, when I had
You
COVID,
probably weren't coming out.
exactly, when I had COVID and I saw how sick I was, nope, I will stay right here because if I go to the hospital, I am not going to walk out those doors. That's exactly how I felt. I had too many colleagues who ended up with COVID, health nuts like I am, that suddenly died. No, that does not make sense to me. Not
Yeah.
at all. Didn't make sense to me at all. So I did all of the things that we were telling people to do at home, lying, doing the prone position, lying on your stomach for the breathing for maximum oxygenation, um, drinking as much water as I could. I didn't get the COVID vaccine. First of all, there was not enough testing on it. Second of all, I didn't have anything to go by. Everything was shut down. When you have your websites are shut down to actually review vaccinations that they expect you to give to a patient, you have no access to as a doctor or a nurse practitioner. I'm certainly not going to recommend it to my patients because there's a reason for this. So there were so many things that happened during that time that made no sense to me. Besides the fact I have cardiolipin antibodies. So I had a stroke when I was 26 years old. And the virus and the vaccine can cause that same blood clotting disorder. So it's you usually get it because of a virus. At the time, they thought that I had gotten mine because of the stress I was under. I was under a great amount of stress in a previous marriage. And I didn't want to get a vaccine that was going to potentially ignite my antiphospholipid syndrome again. Because, how old was I back then? So 6 years ago, I was 57, 58 years old. At 26, I survived a stroke. I'm not sure I would at 58 years old. So I decided not to get the vaccination. So when I got the virus, I did everything I could. I doubled up on my aspirin. I take a 325 milligram aspirin since I was 26. I doubled up on that during COVID, uh, my COVID. I drank twice as much water as I normally do. So this is my water bottle. It's a half a gallon. I drank probably a gallon the entire, every single day, trying to make sure I wasn't producing clots, which happens with the COVID virus. I did everything I possibly could, and luckily I got through it okay. But a lot of people didn't, and unfortunately, they were the ones that ended up in the hospital. Very scary time.
Again, I applaud you because you stood your ground, but there's also an element of common sense there that I don't know how many doctors didn't inherit because it was clear there was many times something smelled rotten in Denmark during COVID. And for a practitioner, a doctor, a naturopath, functional medicine, even someone like myself to be recommending a vaccine where there was no legitimate long-term research. That's just crazy. That's like naivety at its best.
And it was the way the COVID vaccine came out too. Like usually from the research I did, when there's an epidemic like that, they let the first cycle go through so you can learn more about the virus. And then you create the vaccine, and then you have an opportunity to test it, and then you start administering it to people. But people were signing their rights away.
Hmm.
They were putting themselves in a phase 3 trial. The whole thing made absolutely no sense to me. In the other provider's defense, I work, I have my own private practice. If I worked for a bigger organization, I would have to push that vaccine or get fired. Like when you work for another organization, the medical director is the one that sets the pace, and you have to go by what they'll allow to be treated, what they won't allow to be treated. You have to go by what they say. You're not really practicing medicine.
Mhm.
You're doing what they recommend, which is another issue, you know. So, my patients, I think I recommended it to one person, and he was probably a 3 pack a day smoker. And I remember he came into the office for something unrelated. I could not hear any lung sounds whatsoever. And I had said to him, I had already had COVID. I said, if you get COVID, you are not going to survive it. I would recommend, even if it gives you a little bit of immunity, something to prevent you from, ending up literally in the morgue.
Mhm.
So he was probably the only one I really recommended it to. But for the vast majority of people, I told them to kind of wait it out and see. So I did have some people, I don't know about Canada, but a lot of people lost their jobs,
Mhm.
because you have your vaccine. The whole, when I say nothing meant sense to me, nothing made sense to me at all. And I felt like an enigma. Am I the
Really?
only one who sees this? I just
No.
nothing made sense to me. So we're gonna ask you to get the COVID vaccine. Then we're going to bribe you to get the COVID vaccine. You get a free slice of pizza and a beer, or you get a burger and a beer, or something like that. Then we're going to threaten you if you don't get the COVID vaccine. You're going to lose your job. Like, what is going on here? It just made no sense at all. So then I got even more skeptical. So instead of like trying to work on my medical side and ease me into understanding why the COVID vaccine is so important, it was pushing me away even farther. So, and I have very close friends that rolled their arms up so fast because they were more worried about, going on vacations. And I'm thinking, you don't know what they're injecting you with.
Yes.
Stay
Well,
home for
it was that like it's comical now upon reflection, as terrifying as it was that when we were going through it. Now you almost just have to laugh. Like that was crazy. Like the virus doesn't go near you. If you sit down, you can take your mask off, but if you stand up, oh, that's where it's hiding. Like, come on, people, common sense. But I say, well, it just goes to show now how many people do have common sense and didn't. But okay, Dr. Cipriano, we're going to take a short break for a minute, grab some water before we come back for part two, to discuss Epstein-Barr virus.
Okay, perfect.